Did you know that helmets are not only for sports like football or hockey? What comes to mind when you think of a baby with flat head? Hi, my name is Maria Gomez and I'm a CDA, a Certified Dental Assistant. I work in a craniofacial institute where the word flathead is our daily bread. Plagiocephaly is one of many conditions influencing facial asymmetry, jaw deformities during adulthood. But don't panic. Today, I am going to inform you about plagiocephaly or having a flat head and what not to do by discussing environmental factors, sleeping conditions, and intrauterine positioning. Let's take a look. Children all over the world will experience some variation to this condition due to environmental factors. Positional plagiocephaly affects about 50% of children born in the U.S. This is more than 200,000 cases per year, according to the American Academy of Family Physicians. Parents who work all day may find themselves sick in daycare, not taking into consideration that young children may be laying on their back all day long. Parents also want the best for their children, and in today's market, there are many fancy factors that make parents misinterpret their function. Always check with your pediatrician or your craniofacial specialist, as some of these products like the pillows that may help flat spots are just a scam. Always remember to educate yourself and ask all the necessary questions. On the other hand, preferred sleeping positions are not going to help the child's flat head. Just like you and I, a baby will have a preferred way of sleeping, and when they lay on one side of their head more than the other, their head will create negative pressure against the crib or swing, and this will make the skull start to flatten on that one side. The National Association for Plagiocephaly recommends repositioning techniques in order to help improve the child's overall head shape. Putting books on 2 feet of the crib may help the child be tilted just enough to one side of their head to release the pressure on that one side. Lastly, intrauterine positioning of the baby plays a huge role when it comes to flat spots. We all know babies are all stuffed in the woman's belly and squished against everything. As they must live in such a tight space, they develop ways to be comfortable in there. However, when they are born, they are not used to that space, so they remain cramped. Torticollis is a fancy word for a tight muscle or a muscle cramp. Remember when you slept wrong one night and the next day your neck hurt so bad you could not turn your head to one side or the other? This is exactly what happens with babies. It is so important to start neck stretching exercises early, as a stiff neck will cause the baby to be unable to turn their head and will cause them to have eventually a flat spot. All in all, plagiocephaly is influenced by environmental factors, including uneducated parenting, sleeping positions, and intrauterine positioning, which leads to torticollis, always have impact in a flat spot. This condition is not going to hurt the baby's brain or their development, and this is completely cosmetic. There are many resources out there. Make sure you speak to your pediatrician if you notice a flat spot on your baby. Thank you for your time and attention.